wasn't something I had to, you know, go
Right.
through a long period of time. It was just, you know, an immediate thing.
I look at it like a puzzle, that all these pieces go together, and
Mhm.
everybody's puzzle is a little bit different. I mean, I've heard other people that, you know, they got saved and their addiction didn't leave that easily. So I think it's just different for every person. I mean, we can't automatically assume that because somebody's still using, that means they're automatically not saved, right?
Right, yeah.
But,
Oh, yeah, you can always go back, you know, and yeah.
right. But I mean, that's just not always the quick fix. I mean, I truly believe when there's chronic mental health issues, people probably do need medication. But I also believe, just as importantly, they need a support system and they need some therapy. That I think it takes all of those, not just one. I can't just give you medication and boom, you're fixed.
Right,
Because the issues are still there,
right.
right? But it's like with diabetes. If you take your medication for diabetes, you're going to control the symptoms, right? Same thing with schizophrenia and bipolar. But things like depression a lot of times have underlying issues that cause people to be depressed.
The state and county groups, do they have to keep separation of religion and you know, I'm just curious, do they encourage that, or are they allowed to, or?
So I'm part of local government
Right,
at my agency, and we do the wellness center. One of our 8 dimensions of wellness is spirituality.
okay, so you're allowed.
Yeah. We are at ours. I mean, I can't speak for every agency, but we really look at total wellness, and you've got to look at the whole person for that. I'm a firm believer in that.
Yeah, because a lot of drugs, they just, you know, mask it, they don't cure it, they just help you with it.
Right.
Even like you say, diabetes, you gotta know the cause, of what's the problem is to overcome it, you know, to get you off that
Right.
medication, so.
And you know what? Maybe I've got financial issues, and the drugs was just a way to escape that. Maybe if you fix my financial issues,
Right.
it's going to help fix the other. I mean, I can get into treatment, and
Mhm.
you know, this is my biggie for substance use folks. People say, well, you can't get a job or you can't get housing until you get clean. Well, the research shows people need a reason to get clean. So they need a place to work and a reason to get up and go every day. Why should I stay clean?
You're right.
If I have nothing, if I have no house and I have no job and no way to pay any bills, what's the
Yeah.
point, right?
Yeah.
So we try to punish people. I mean, that's the old school way, is that you got to get clean before we can do
Yeah.
anything to help you. And I think we have to meet people where they are,
Mhm.
and that's not always easy for people. I mean, I had that happen. Another guy's office is in the same building I am, and it was really interesting. The guy came to see him this week, and he had 3 or 4 beers that morning before he came. He said, "Well, I can't see you. You've had alcohol." So he brought him down to my office and said, "Can you help him? Because I can't. Our policy is we can't help him, and it's a substance abuse provider." That's the interesting thing. He said, "Can you help him? I can't because he's had 3 or 4 beers and I'm not allowed to." And I said, "Sure." So when we got to talking, I knew medically he was dependent on those 3 or 4 beers to function, so that he wouldn't go into medical withdrawal from the alcohol. So, I mean, I had to meet him where he was. I mean, he wasn't belligerent. That was just enough to make him be able to function. So, our policies may have always been that we didn't treat people if they were drinking, or we didn't give them housing, or we didn't help them get a job. But sometimes we have to think about our policies, and is it really the system that's hurting the person? Because I'm a huge believer. A lot of times I think the system fails people.
What do you think about this, the things that they're talking about, that people who get food stamps and Medicaid and think have to be drug tested?
This
There
is
you go,
on the
it's
Terra
going to
opinion
be-
side.
I'm agreeing with you're saying is you're trying to fix this one thing, and this gentleman had to have 3 beers in order to get functioning and everything, be able to do things. So if he's on Medicaid or food stamps, now that just shot all that pretty much. That's going to have him to have more than 3 beers that day.
Right. And it's the same kind of thing as far as the housing, in my opinion. And it's funny because I just posted something on Facebook recently with one of the county commissioners, because he asked that same question. And I said, my response was, 1, you got to understand addiction first, and 2, it can't be just we're pulling the blanket out from under you, because that same logic. Okay, so if you pull the blanket out from under me, what reason do I have to stop? Yes, I totally believe in consequences, and there should be a plan, and we work that plan. But part of that is us helping make sure they've got the supports in place too, that they have the resources they need. Because most of these folks don't. I mean, they don't know how to access the resources. Even tonight, do you know how to access all the mental health services there are out there?
I mean, that is true. I mean, even like where we live over in Madison Housing, some of the people, we had gone and got energy assistance. And a lot of the people there didn't even know that existed.
Right.
And we took around flyers and everything and said, hey, you know, you need to apply. 2 or 3 people said, oh, and that was great, because they did go and get help, but they didn't have the knowledge that they didn't know it, and it's been out there.
I mean, there's tons of different kinds of Medicaid, probably 20, 30 different kinds of Medicaid. I mean, there's a lot of different kinds. One of those is what's called MQB Medicaid, that just helps seniors pay for their Medicare premiums. That's all it covers. But even that $100 in somebody's check can make a difference.
No, I meant about the energy.
Yeah, but I'm just saying, that's another example too that people don't know about is out there. I mean, there's tons of resources.
Locally, when I signed up for my Medicare and Medicaid and all that stuff, the people that helped me sign up for that, so I have that, and it helps me
Right.
tremendously.
Right. That can be, I mean, it can be the difference in buying groceries for some people.
Exactly.
I do medical billing, and so this is kind of funny, but I had a lady call today. She said, well, didn't Medicare pay my bill? And I said, they paid what they would pay, but you have a deductible. And she said, oh, I didn't know that. And and we talk about this at work, people are not aware of any insurance, I don't care if it's Medicare or what it is, what your actual coverages are. Because it used to be many years ago, if you had hospitalization or medical coverage, it paid everything. And then all of a sudden they started with deductibles and co-insurance and all this stuff. People don't understand it. And I think that's true with everything. The education is the bottom line. We need to educate the people.
Well, and when you really truly look at that whole person, there's so many different resources, the mental health and substance abuse resources, you know, the economic resources that are out there, just, you know, simple things like the LEAP program. I mean, and it's like, how do you learn all these different things? I can say it's been a process over my 20 years, and I've had to learn, when a client needed something, I had to go dig and figure out. What about the veteran world? I don't know how many of you have had to navigate the VA, but it is ridiculous.
It's a nightmare.
And you've got 3 appointments at the VA, they're all on 3 different days. They can't consolidate them and make them all in one day, it's tough too. So, be patient with people, you know, and really try to help them. I had a family, I'll get you in just a second, I had a family come in this week, and all they wanted was substance abuse services for a 17-year-old. And I ended up having to make about 10 different phone calls. She said, I sure am glad you did this, because I'd have stopped after about the 3rd one. But it was knowing the right questions to ask too, because that's huge.
I was looking at this and I saw that these are adult classes. When are the,
I can get you a schedule of the youth classes too. And we actually just had a school in Forsyth County, the early college kids said, hey, we want a youth mental health first aid class at our school. And we did that for them, so.
Is it like during the day?
What's that?
Are classes during the day?
That one we did in the we did like 3:30 to 7 or something when they got out of school.
I'm out of school yet.
Huh?
I'm out of school yet.
when we get out of school, most high schools release at 3:40 most year, except for the early college releases.
Yeah, and we worked it out with every school's different. Our schools get out here 2:30, 2:45, so.
You see, with like health classes, you take a health class, and in that class they cover, in the mental health section, you cover stress, you cover minor and major depression, and how to reduce your stress, how to reduce your reaction to stress and how it affects you. That's all you learn. And you see, like, and I had to do research separate from that because I've had friends that have had mental disorders or have needed help like because of suicidal thoughts and actions and stuff like that. And they don't teach the kids don't know how to assess situations like that. So if they had a friend who was suicidal, they wouldn't know what to do.
Yeah.
They tell them they would do this thing that everybody does, which isn't the right thing to do. They'd say, it's okay, you're gonna be fine, because they can't process promise, and then they're gonna be fine.
And remember, we don't make a promise, we follow through on. I never like make that promise, right? Cause I can't, if you're not with me 24/7, I can't guarantee that.
Like in the medical profession, if you're doing surgery on somebody, you never say to their family beforehand, they will come out, they'll be okay. You never say that, because you don't know.
I've only been with the lot a few times, but they were talking about how they don't see a lot of people going to the church. The people that I see here would not have been comfortable in my church because, to go to church service or, because everybody's all dressed up. They have a collection. Now, you don't have to put money in, but people who don't have money are gonna feel awkward about that. So when they come here, they see the way Marty's dressed and everybody's kind of in jeans and casual, and they can feel more comfortable, I think. So unless they go to a church after hours, but so many of the churches are locked after the services, you can't even get in. So I think this place is a godsend, really.
And I think about that when I work with clients in the community, just how how I'm dressed. I go in jeans a lot of times if I know I'm dealing with a client, because I want them to feel at ease and not feel like I'm some person that's up here and, try to get on their level. I've been in some pretty rough houses in my 20 years too. Not always the best situations, but I don't let it affect how I'm working with that person. Somebody else had a question?
I was gonna say, I stopped going to a church, because the ladies of I don't own a dress. I don't even wanna be buried in a dress. But, and they, the ladies of the church came to me and said that we prefer our women to be in dresses. I was like,
Yeah.
yeah, you know, so.
And when my daughter's with me, my church, we can wear jeans. When she goes to her dad's church, it's like that. And the women would come to you and tell you that's
Well, I
something.
had dress slacks on and everything. It wasn't like I went in ragged
Isn't
jeans
that
or anything
terrible?
like that. They
But my
just-
daughter is like you. My daughter is not into dresses. She is a big tomboy and she wants nothing to do with a dress. And so it's like she doesn't enjoy going to church at that church because all she's focused on is what she has to wear. And that's why I'm a firm believer in meet people where they are, and that's part of it.
To work at Centerpoint, for most of the positions, do you need a master's degree?
Now, then we have some positions that are 4-year degrees too.
What kind of mental health disorders do you deal with, like bipolar and stuff?
Do I deal with bipolar, depression, some schizophrenia? It's not as prevalent here as the team that I worked on in Guilford County. PTSD, a lot more now than used to, and then personality disorders, a lot of borderline personality disorder. But I'm also specially trained to deal with borderline personality disorder too. And I will tell you, that's one of those populations, the cutters, in the mental health world. If you ask people who they do not like to work with, most people will tell you people with borderline personality disorder. Again, it was a thing of not knowing what to do with them. I took a class that was 12 days of training, and it made all the difference in the world in my attitude dealing with people that have borderline personality disorder. But I saw people go through the class with me and stay out of the hospital that were in and out of the hospital every week or every other week. So I saw teaching them the skills that they need to deal with that made a difference.
Excellent.
Any other questions?
What's your last name, Tara?
Tara Tucker. And I can give you my work phone too.
Okay. Tara Southers?
Tucker with a T.
I'm sorry. And your work phone number?
816-2851.
Thank you.
Put it on speed dial.
All right,
That's my
guys.
work.
Let's give her a big hand.
Thank you.
Marty knows how to remind me if y'all need something.
Yeah, that's true. We can definitely find her. Thank you so much, Tara, guys. Thank you so much for taking time to invest in yourselves. I hope it was edifying. So,
Very enjoyable.
yeah, it's a great subject and one that she teaches on. She does. I'm sure she told you she does multiple certifications on it. So, Jay did mental health first aid awareness, and they did for youth as
He
well,
did the
right?
adult and the youth one.
Yeah, and I did the adult last year, and then looking at maybe doing the CIT this year, but a lot of classes available. If you guys find yourself with some vacation time and you want to get certified, they're doing trainings about every other month right now. We can get you plugged into those, it was great to go to class and find out that we were doing a lot of things right. Because sometimes when you go to the classes, you're scared that that it's going to be completely different than what you thought. But we learned so much going over there, especially from resources in the county. It was just an excellent opportunity, so thank you. We're going to do a quick cleanup. If I could get maybe just a couple hands of people that could throw some stuff away, break down the tables, and put Jay's Bible study classroom back to the way it was, which is just 3 rows of chairs.